and do a little more formal greeting because we have longer and shorter term members of this group. So let's just go around and say hello to one another. And then I've got some information to share with you just to follow up from our last meeting. And then we'll just do report-ins and see what you're all up to. So I'm Susan Summers. I have the honor and pleasure of working with this group the last three or so years. And it's a labor of love. I've learned a lot from you. And without further ado, I'll hand it to Jill. For those of you, I guess everybody knows Jill, but anyways, let's give her a chance to say hi.
Hi, everyone. Good morning or good afternoon, depending on where you are. Thanks so much for joining us for these monthly meetings. I know that I learn a lot, so I hope they're useful to you. And for those of you that clicked on a little bit late, I want to apologize in advance. I'm probably going to have to step away because I'm in caregiving mode at the moment, but I'll try to hang out as long as I can.
Thanks, Jill. So I'll do a little roll call here. Claire, do you want to say hello?
Hi, everyone. My name is Claire. Excuse me. I'm the student intern at NYSOFA, and I work with Abby and Dina.
Welcome. And we've met you before, but not everybody was on that call. So thank you. And Talina, do you want to say hello?
Good morning, everyone. Talina Ford, Program Supervisor, Oklahoma Human Services.
Thanks, Talina. And Nadine?
Good morning.
Good morning.
Talina and Jennifer. We are all Oklahomans and work very closely together at our state office in Oklahoma. Have the 3-year and the 5-year lifespan respite grant right now.
Thanks, Nadine. Abby.
Hi, everyone. Abby Daraponsny with the New York State Office for the Aging.
Thanks, Abby. And Ashley.
Hey, this is Ashley Martin with ADSD's Lifespan Respite Program in the South.
Thanks, Ashley. Let's see, who am I missing here? Nadine, Abby. Did I get everyone? Jennifer, is Jennifer still on?
Yes, I'm here. Jennifer Hill with Oklahoma Human Services. I work with Nadine and Talina.
Hi, Jennifer, thanks.
I don't think you got Yasmin.
Oh, Corey.
Well, I'll introduce myself too. I'm Corey
We just
with Helping Hands of Vegas Valley and the Nevada Lifespan Respite Care Coalition.
Thanks, Corey. Corey's like one of our longest, most esteemed members, and we just had like a long conversation. This has to do with my 71-year-old mind, Corey, and not your importance to the group. So thank you. So last meeting.
Don't forget Yasmin.
Oh, sorry. I'm so technologically, she's not even showing on where are you, Yasmin? Oh, there you are. Okay, Yasmin. Thanks, Jill.
Hi, everyone. I'm Yasmin Orozco, and I work with the Nevada Lifespan Respite Program. And I have Ashley on here with me. I'm the project coordinator for our 3-year Nevada Lifespan Respite grant. And we also have 2 5-year lifespan respite grants.
So you're busy.
We're busy.
That's great. And Ashley, hi. Do you want to say hello? Did you already do that? Yeah.
She already said hi.
Okay.
Yeah, I already said hi.
Really sorry. And I'm really terrible at this part. I'm like scrolling across. Oh, I miss the days we sat around tables. So we generally do, for those of you who haven't been here before, we just have a report in about how we're doing either with real in-time planning of sustainability or any sustainability related activities. I'm going to share screen here. Hold on. Everybody see that okay?
I
Um,
can.
Okay, great. So the last time we met, if you look on the right side of this slide, we talked about this framework, and I actually did some revisions based on feedback from the group, and we talked about just to go back in time. This group started, for those of you who don't know the history, this group started with grants that went out to the network, and there were 5 states that did sustainability planning using this toolkit. And it was quite a comprehensive, wonderful toolkit that was kind of difficult to use for some, a little bit daunting. And also, even though the grants were 3-year grants, it was difficult for people to accomplish all they needed to accomplish in that time. Sounds like a long time, but what we've learned in this group is sustainability is like takes even longer than that for many states just to get the planning part done. And Abby from New York, they're the one state that has actually gone through the whole toolkit and accomplished a plan, and she can attest to that it takes a big investment to do it, and a really worthwhile investment, but a big investment. So based on what we learned from them and from all of you in these meetings, I've started doing this kind of a scaffold for learning and understanding sustainability. And one of the reasons we wanted to do this is we want to make accessible to the whole network all that you have learned and all that you know, and to share information with others. So today we're going to talk about the foundation of sustainability collaborative partnership. So this is one of the second of the 7 ingredients for planning. And one of the things that I've done, again, in the last meeting, we talked about, of those 7 things, the things that seemed most important to this group was coalition building, number 2, and then number 3, a self-assessment for planning, and then the number 7, outreach, education, and advocacy. So what I've started doing is going through the literature to find things that I think might have real utility for all of you, but also be easy to use, easy to understand, and of high quality. So, and all these will be available on the Arch website. So I came across something, and probably a lot of you know about this, but if you don't, you should. It's called the Community Toolbox, and it's from the Center for Community Health and Development from University of Kansas. And in this toolbox, they have developed a 5-part series of coalition development guides. And you see the link below, and again, we'll post all this too. And I want to just go through really briefly the guide about forming a coalition. And one of the reasons that I like this, their products are really, really understandable and comprehensive. They have multiple authors that contribute. But when I came upon this, I just thought it maps so closely onto what we've learned, to the evaluation that we did of the original grants, and to what I've learned from all of you on these calls. And it reminded me of like when I was in graduate school. Just a little story for a minute. We were in a seminar, a doctoral level seminar, and one of the students asked our advisor, who is the kind of grand dame of early childhood special education, that's my background, about an article she had written. And I remember her saying, "Did I write that? I don't think I believe that anymore." And I just thought that's always stayed with me, because we sort of are stuck in the moment and the task in front of us, and we forget what we already know, or how comprehensive it is that we know just from our own work experience. And we don't always, we keep doing things sometimes that we don't really examine to see if they're still working. So one of the reasons I liked this, the document itself is like 25 pages. And it just reminded me of what we know in a really clear way. And so they talk about in this first one, why you do it. And I just saw so many overlaps with respite provision, empower elements of the community, actually obtain or provide services, make services more effective and efficient. And one of the things they don't say here that is really important to us is just access to services, pooling resources, increasing communication and breaking down stereotypes. This came up so often when we did the research breakout groups about, I guess it's been about 2 years ago, communication among groups and particularly underserved groups. And just give a shout out to Corey, because she, Nevada did a study about this and learned so much. And I still remember, Corey, what you offered to that group and how important it was for access and to keep people engaged in respite from underserved communities. Revitalize sagging energies of group members. One of the things that we've seen with coalitions that even seems strong is that they kind of lose momentum over time. And so we have to rebuild. Plan and launch initiatives. New York's a great example of this, the initiatives that have come out of their planning. Develop and use political clout. Oklahoma is really great at this. Alabama's really great at this. And create long-term permanent social change. And that one, I think you see the Wisconsin Coalition's contribution to their work on training. So there's an overlap in that initiative for national training standards and the work of the coalition. So I think you can think big when you start. You have to start small, but I think you can think big. You can see that in the coalitions that are part of the respite network. Barriers to starting a coalition: turf issues, bad history, domination by professionals or some other elite, or links to the community, minimal organizational capacity. This came up in the evaluation of the 5 original grants. Funding is a problem right now for some of our, for some coalitions around the country. Failure to provide and create leadership in the coalition. This is a really interesting and tricky one because some of the coalitions have had the strongest leaders. Once that leader left, were not able to sustain. So that's something we've talked a lot about in this group, how to mentor. And you see on this call, people that have come on teams. That's one of the most important signs for us. If you have team members with you, if you're mentoring people in your group, and I've seen people in this group just grow and grow and grow in knowledge and expertise and confidence, and it's really wonderful. So that's a big one for us. And then the perceived or actual cost of working together outweigh the benefits for a coalition. This can be huge too for really busy people who are absolutely sick of being in meetings, like making it evident the value of what you're doing. And I want to kind of hit that later on, not in this meeting, but in another meeting. I started thinking a lot about how we think about measuring services, but we don't often capture the value of what we're doing in a coalition, what the coalition itself does in terms of hours, expertise, resources. So we'll visit that sometime next year. And who should be a part? Stakeholders, those affected by the issue, formal and informal helpers. We're probably tend to be light on those affected by the issue. So a good thing to think about in this group is how to meaningfully involve and support caregivers as stakeholders, community opinion leaders. And that when I read this, I thought again about Nevada's work and connecting with underserved communities, and the network and researchers in the network have talked about particularly with cultural sensitivity, cultural outreach, finding somebody had a really good label for this, and now I'm not thinking of it, but finding those key people in communities, kind of elders, the wise people, the people in the know, and making sure they're involved and involving them in a way, asking them like to how you can make their involvement meaningful to them, and being able to have that conversation about relative ways of meeting, helping, and working, so that you don't exclude people without knowing that you're doing it, or not understanding why you're doing it. And then if you can get them on your coalition, please include policymakers. How do you start a community coalition? Whoops, coalition is misspelled. I'm sorry, I always misspell that word. Put together a core group. And so you all have functioning coalitions, but I know like Idaho's been struggling with maintaining it, and we've had states where the coalitions have not been as strong as they wanted to. So this core group it doesn't just have to be at the beginning. You can kind of go back to that core group. You just don't want them to overpower. Identify the most important potential coalition members, recruit members to the coalition, plan and hold a first meeting. And so this is just to give you an idea what's in this document. I'm just giving you the headers, then they give you really great information for all of these. But you'll notice in this planning and holding a first meeting, planning already begins, but it's not the same planning as what happened in New York, the sustainability planning. But it's kind of, Abby, you might talk to this, but it seems to me with New York, it evolved, that core group is the one that made the sustainability planning possible. And you kind of have to come back to the core group to keep the larger group going. And I think this doesn't always happen in coalitions, but I think that it's really important. And then follow up on next steps. And then the general guidelines. And I just want to go down to just hit a couple of these: the inclusive and participatory as you can be, networking like crazy, and being creative about meetings. And I think that in my own experience, I went back to this time when I moved from Seattle, where I was teaching at the University of Washington, and moved on top of a mountaintop in Utah for love, and worked on a big coalition to do planning and conservation. And the way I was roped into that was at first a dinner, and then this huge camping trip. And being outdoors and hiking and doing things together was a way just to get to people connect. It was like, when I think back on it, it was like a retreat. Now, 25 years later, these are some of my closest, dearest friends, because not only did we do the fluorescent lighted meetings together, but we just spent time together, knowing one another. And the other thing that I would say about that experience is that we had real grassroots support and incredible diversity in the membership. We had a lot of really powerful people who could get things done. And that was a sort of management thing in and of itself, because there were a lot of egos. And but I would say that it's worth learning how to navigate those uncomfortable times when there are power struggles, like how not to buy into them, how to listen, how to support, and how not to let people in power overpower people with less power. Like for us, it would be typically caregivers, but also people like on in the sort of pecking order of agencies and state agencies. It's a real there's some real juggling going on, and I know some of you could talk about that in your own work, but that that inclusiveness, that diversity, and that inclusion of people that have different, that bring different levels of societal power to you is like, it's definitely worth doing, even if it's difficult. And then the praising and rewarding contributions, I think that goes back in part to collecting data on what you're doing and as a coalition itself. And again, I'll talk about that later. So this is a community toolbox. And what I talked about today was from the main selection, but they also have checklists. Examples are really case studies, and they have tools. So they have, you can go and find things, excuse me, that may be useful to you, if that's of interest to you. Okay. Now, can you see me again, Jill? How do I get back to, do I hit share screen again?
Are you trying to share your screen again?
No, I'm just trying, can you see me okay?
Yeah, we see
Oh, okay.
everybody.
See you.
Okay, I just have a black screen because the screens are on. Okay, so any comments about that before we go around, or anybody struggling with coalitions? I wish Idaho was on the call, because they're kind of going through this. And well, before I start around, I did have a question for Abby. And Abby, you may not know the answer, but after the last call, no, it was call before last, Dina sent me this form that she had found from California about coalition membership. Do you know anything about that? I know Doris has brought this up in this meeting for a few times, like how to structure and whether to charge for coalition membership. Does that ring a bell with you?
I don't know anything about the form, but I
Okay.
know that it's something that Doris has considered. She actually, I think they did put in place a membership campaign because they advertised it at the conference that we had over the summer, the caregiver conference.
Okay.
But I'm not sure if Doris has received any forms back of people that wanted to become members of the coalition.
Okay, so we're going to put a pin in that one and come back to it, because it's really interesting to me, because New York is such a strong state and doing so much, but still really thinking about how to make that coalition work through its membership and keep it strong. And I really laud that, what you're doing. So we'll revisit that, and I'll reach out to Dina. I just didn't want to, you guys are so busy. I didn't want to do an extra call with her. I was just going to try and get her on this call and see what's going on. Okay, so should we just start with New York? Do you want to tell us what you're up to?
Yeah, I can give some updates. So one thing that I wanted to share was about our New York Connects program, which is the Aging and Disability Resource Center in New York State. So it's our No Wrong Door. So a lot of times when Doris would be going out and meeting with different respite programs to tell them about the coalition, she would, find out that they weren't listed in the New York Connects resource directory. We have like a very robust directory where people can go online and search for any type of resource, but specifically respite and caregiving resources are included in there. So we developed a form that people could fill out if, when talking to Doris, it was realized that they weren't in the directory or if they were a new program. So we developed that form earlier this year, and it's on the coalition's website. So Doris, has a place to direct people if they want to be added to the New York Connects resource directory. And we did receive 2 submissions so far. So, and we just got them, I think, last month. So we were excited to get those. And another thing we're doing, we just released a program instruction for the National Family Caregiver Support Program. So, and we expanded our caregiver directed model. So currently we only allowed for in-home respite options, but now we're going to allow for out-of-home respite and the use of vouchers under the program under the Older Americans Act. And we're considering having the AAAs who administer the program partner with the coalition to administer vouchers if they're interested in offering that model.
That's
So
great.
that's kind of what we're working on.
And I always like to bring this back to sustainability. And one of the things that really stands out for me about New York is that as a group, you're always looking to make sure things work and to make them better. And that's really important for sustainability. It's not a one and done. And you don't let things languish and die. There's always improvement. And you just kind of feel a lot of energy and life around what you're doing. And so I think it's always exciting to hear from you. So thank you. Who would like to go next? I'll just let you jump in when you're ready.
Hi, this is Corey, and I'm gonna let Yaz speak for Nevada, but I had a question for Abby. On that form for the Nevada Care Connect, or not Nevada, New York Care Connect, sorry, that you guys are doing, is it any agent? Was it an agency or a for-profit or a nonprofit that can be added to that?
Yeah, it's anybody. The form on the coalition's website is specifically for like caregiving and respite resources, but the directory is for all like long-term services and supports and caregiver resources.
Okay, and so that's strictly from the coalition aspect. It's not through the state, or is it both?
The directory is through the state, and then we just recognized that like when Doris from the coalition was going out and meeting with respite programs that, you know, she would ask them, are you in the New York Connect resource directory? So that if caregivers went on and they wanted to find a respite provider or a respite program, to make sure that they were on there. So we developed this form specifically to be put on the coalition's website for any caregiving and respite programs that Doris knows of or talks to that are not in the directory.
Okay, thank you. I was just curious.
That was a good question. It made me think of one too, Abby. So like, are other people on the coalition kind of attuned to that they could, you know, if they're not just on looking at the website, but talking to one another, do you encourage other people to, when they come across programs, just to check on that?
Yes.
Okay, that's great. Okay, good work. And who'd love to go next?
I can go next for Nevada.
Thank you.
Sure. So we are actively working on 3 different grants right now. So it's been, you know, kind of just starting those initial activities for the most recently awarded grant that we received in August, which is our lifespan respite dual diagnosis grant. And then, so for that one, we are in the process of working on a steering committee so that we also have an analysis of what respite services and gaps are in their state. And we're also trying to figure out how we can better assess training opportunities for families who have a dual diagnosis child or young or youth, I would say. And then with our lifespan enhancement grant, Ashley has been working diligently to establish educating community partners within our state with other organizations that we're trying to create partnerships with. And then we're also working on how to connect internship sites and placement for students or young adults who would like to participate in this. And I believe there's a stipend of $1,500. Correct me if I'm wrong, Ashley. And yeah, we're just working on getting those efforts for our respite training and internship for our state. And then on our other part of our original lifespan respite grant, we're also working on creating those outreach and educating the public on respite. So we have a good outline and planning on community events for 2023, since it's going to be our last year with the original lifespan respite grant. And so we're hoping to go big and participate in some community outreach. And so I've been speaking with Corey, and so I'm really trying to, since I'm in the North Nevada area, I'm really trying to gear activities and community outreach in Southern Nevada as well as Northern Nevada
Oh, that's
in our rural areas.
That's great. Yeah, that's so important for Nevada. The first thing you talked about was the assessment of resources and gaps. And your state's always been so strong on measurement and knowing what's going on. Would you talk a little bit about how you're going about that, doing the assessment, and what you hope to learn? This is so critical for sustainability planning. So I kind of just
So I wish I could talk more into depth and detail with that. I haven't been part of those conversations with my chief yet. And so I don't know specifically what that will look like. Once she starts to officially work with us more, she starts her official day with us on our grant on Monday. So for our next meeting, I'll definitely take a note on that and provide a better answer on that.
Oh, that's great. We're excited to learn about what you're up to and how you're going about it in a state that has rural areas and lots of underserved population.
Yeah.
So it'll be exciting just to see your approach and what you learn.
Yeah, specifically for youth and children's services. With our emergency respite funding that we have right now, we definitely see a higher need for families who have children with dual diagnosis or mental and behavioral diagnosis. So it's been an eye opener for sure.
Yeah, that's great that you're paying attention to that. It's interesting with the innovative and exemplary practice programs that Arch's initiative, when we interviewed the first round of programs in 2019, many of the programs that were really excellent were not serving children with mental health behavioral problems because they were so difficult to serve and they didn't feel equipped and competent to serve them. And each year we do the interviews, we're seeing more attention at the level of service and programs to this. So I think you're on to something really important, and we look forward to learning more about that, how you find families and how you fund services. And that's all really important for sustainability. So, wow, you're up to good things. So thank you so much. So let's hear from Oklahoma.
Are we there? All right. This is Jennifer. And currently, like on our coalition side, we've been working on cleaning up our list. We noticed that over time things happen and the lists don't get updated like they needed to. So we've spent some time getting that all cleaned up, and we've been working on kind of redoing our coalition setup form as well, just to make it more user-friendly and just more relevant for what we were needing to, the information we needed to get from them. And on the lifespan side for the grants, we're working on our RFP development for the mini grants. So that's kind of where we are. We're kind of in this state where we're looking at moving forward. So
would you, for this group, just talk a little bit about your coalition, just so I learn about all of your work from a distance. Much to my dismay, I can't be at a coalition meeting or sit down and talk with you at length and in person. But from afar, I've always been really impressed about the structure of the coalition in Oklahoma and what you've been able to accomplish, the inclusivity and the practical activities that you do. And so talk a little about your members, because you have a lot of members. Talk a little bit about your membership and like how, what you feel it's important to members to accomplish, and how you keep, you talked about just now, you talked about kind of doing some reviving of it or like tweaking of it. So talk about why you're doing that, and what made you want to do that.
I'm going to let Talina take
Yeah,
this
I'm going to
because-
jump in here and help Jennifer a little bit. So, it's a moving target. We've joked about that quite a bit lately. Just finding out what caregivers need and what services are being offered. They're ever changing with technology. And we find that if we just listen, that we're going to be able to, everything needs to change, and how often that change needs to happen. That's something that we're in discussion with, but just really developing those relationships and listening. And, I think we're really good about when we develop those relationships, really honoring them. And when they have programs and things going on, we're like, how do we share? How do we help you grow? That's what we're all in this business to do, is get information out to our caregivers within Oklahoma. And we really, our goal as a coalition is to make sure everybody has that information and is a pathway to share that information amongst each other, and ultimately get it to those caregivers that need it. And I think we do a really good job of that, not only through email, but through our social media channels and through word of mouth. And, having Nadine on our team and everything, we've got some really well-respected individuals in this field that people look at and say, oh, if she's promoting it, or if they are promoting it, if the state's promoting it, then we should probably take a look and see what's happening there. So I think it's just a really well-rounded experience and developed coalition at this point that people want to be a part of it. And we devote quite a bit of time to it. It's something we're passionate about and hope to continue to see it grow. And I think that's what we're doing. Did that help?
It does help. And when I hear you talking right away, first of all, you didn't hesitate. You know exactly what you're about and what you said our goals is. So everybody understands the overriding purpose and feels like it's a worthwhile purpose for there. And that's like, it just seems like we shouldn't have to say it, but have you gone to meetings where you just didn't really know why you were there or what the group was doing? It's really important to be able to do what you just did.
Yeah, we're there to collaborate.
Yes. Yeah. And yet, I think probably since COVID, you don't do this, but I just always loved your lunch and learns. The practical outreach that you did. And I'm trying to see if I remember this correctly too. Didn't you kind of have an ask the expert thing? Like you made the expertise on the coalition. Nadine, jump in if I'm misremembering. It could be another state, but I seem to remember that you have people with a lot of expertise and a lot of clout. You also are really, like you said, you're really listening, you know what's going on. You're not divorced from the day-to-day practice of respite in your state. So you have communication from that, it's that broad stakeholder idea that from all levels, providers and users of service, what's needed and what the current status is.
Yeah.
And that seems like really important to me.
Susan, I'm sorry, I had to step off for a little bit, and Jennifer and Talina did a fantastic job talking about our programs. But yeah, we have quarterly meetings, and those quarterly meetings, we highlight our representatives. I don't know, we're trying to figure out how many partners we really have.
Uh-huh.
It's exploded, 200, I'm guessing, on the
Wow.
coalition, no membership fees, just come and go as you can. We just keep it very open, but that sustainability, I think if Lifespan went away today, we're good. We're good. We've got, like Talina said, we've got that representation and it's across the board. The rich, the good, bad, and ugly, we got them all on that coalition. But I did want to talk about sustainability with our voucher program. We partner with other agencies like mental health. We have their voucher programs. We have other developmental disabilities. We have some of their voucher funding program. We have all these different voucher programs that fall under one, which is beautiful. And then we have our respite voucher programs, 8 of them. We meet quarterly. And we talk as a group, so we're making good connections. So that's sustainability, that we can sustain each other's programs and be sure we know how to talk of each other. Our conference, the sustainability of that, since we went virtual, it doesn't take a whole lot to sustain that other than a fabulous staff behind it.
Yeah.
To be able to push that, but we are going hybrid next year, and we do have had a partner come forward and with funding to help us go hybrid. So it's just, they want to be a part of us, they see how successful we've been. Our website, have a great website. We charge for-profits $250 a year, but it helps us maintain it, right? There's the sustainability there. The nonprofits don't pay anything. Jennifer hit on our mini grants that we were wanting to do a respite registry. Our leadership said, no, we're not going to take on that liability. So we've switched to doing mini grants across the state to get some seed money out there to get these little projects started and rolling, and looking at sustainability very closely on those grant funding. So when we step away, they can continue.
Yeah.
So those are just some things that, we always have sustainability on our front mind of anything we start. How, if we can't sustain it some way, it's not good to probably do. But I probably added too much, but I wanted to just show you all, again, I could go on and on, but just wanted to point out a few things that I know we're pretty strong on our sustainability plans. And our strategic plan, we're getting ready to have another one in February, and that will be on our plate. How are we going to sustain all this?
Yeah. So would you talk a little bit about the difference between a strategic plan and a sustainability plan?
I kind of see them together. I don't think you can strategically plan without a sustainability plan in place.
Yeah.
That's my vision.
Yeah.
I think you talk about strategic planning. What's your vision? What's your goal? But how are you going to sustain it?
That's a good and impressive report from Oklahoma. Do you all have, did I miss anybody? We've got Nevada, Oklahoma, New York. Do you have questions for one another? This is a quiet group today. Any good advice for one another? Anybody have any issues that this is a brainy group? Anything you're struggling with? This would be the group to ask. Mel, it's all good.
Can I ask a question about Nevada? There was one of the things you talked about, Yasmin, on training. I think again, I had a call that I had to take and I got interrupted, but something about the education part of maybe the newer grant you have. Can you talk a little bit more about that? Did I miss it completely? It's kind of in the middle, something you were talking about what you're doing with maybe one of your 5-year grants.
Was it for the dual diagnosis grant or our enhancement grant?
Maybe the
'Cause those are
enhancement
the two
grant.
ones that we have.
I think the enhancement grant.
The enhancement grant. So we have we were able to use our pilot project training that we used from the Respite Care of Wisconsin. We were one of those 11 states to participate in that pilot project. So we're taking that training. We're going to continue to use it for now, but we're enhancing it. And so we're going to use that as part of our training to create some internship foundation with our partner agencies or any nonprofits, anybody that we can reach out to that really wants to participate in becoming respite care providers. And so in enhancing the training, and Ashley can speak better to that because she's done a fabulous job of really making it more tailored to what we see in our state. And so we're hoping that with that training, they have a foundation to start and kind of understand what they're going to face in the field. And that helps to kind of tag team with what they're learning in their curriculum with their degree that they're majoring in. So if they're like social work majors, human and family services, or human and family development studies, pre-nursing, anything that we could think of that requires that service learning experience. We're trying to establish some connections there so we could, enhance their learning and really get them some of that direct service that they're going to be working towards in their internship. And so that's kind of where we're leading our future activities and projects with. And then I don't know yet on how we're going to do our mental or our dual diagnosis grant for educating and training. But I have a feeling we'll probably do something similar. So.
We were one of the states too with that Wisconsin training, but we had to take we loved the training. We were involved in it, but like I mentioned earlier, our leadership was not willing to take on the liability of having a respite registry. So we've backed out of that, but I do want to take that education, and what you're hitting on is something I've been interested in, how to connect with nursing programs. How do we say this is very important and it's important enough to include this in your curriculum? That's where what kind of sparked my interest on what you were talking about is I've not tried, to be honest with you, approaching any nursing program, for example, to insert that curriculum. But if you have any hints of good ways to do that or good approaches with academia on how to sell this, I'd really like to hear that, because we need to go that route. We learned all this in Wisconsin's education, and it's just fabulous. It's really, really good. And we added to it. We tweaked it some. It's ready to go. It's just we hit a roadblock, and now we kind of have to back out. We can't put it on a registry, but it's still good education to get out to academia that it would apply to.
Yeah.
Yeah, and I think it's kind of like that trial and error. We kind of hit a little bit of a bump with our university because they don't specifically like to do those home setting type of service learning unless they are being supervised. And so we're kind of figuring out what the best option will be because we don't really have like centers where respite is provided other than like, for example, our Northern Nevada Rave Center, which is not specifically, it's respite, but it's for children that have some disabilities, but they're not like what I would call more of that medical respite, which is one of like another gaps in services that we see in this state. So I think we're gonna have to kind of think outside the box and figure out what would be the best option for that, because I know for nursing, they have to be supervised. They need to have a clinician with them, so they may not be able to do some of that home respite care that we
Yeah.
were hoping
Yeah.
to. So we're just kind of like thinking, brainstorming on other ideas.
I think I can help with this one. When we did our podcast series, 2 of the podcasts were with university-based programs. And the one in particular I'm thinking about was with Chris McGrain from Rhode Island. Now they used their grant to do training in nursing programs. And they have now, I think, 5 colleges and universities involved. And then the other interview was with Melissa Leeson, who was in Virginia, and now she's in, she just moved university, so I'll have to get back to you on that. But I can give you contact information and, help set up a conversation. But particularly in Rhode Island, and if you listen to the podcast, one of the things they talk about is that there are new nursing requirements that completely mesh beautifully with providing respite through nursing programs, that those requirements can be met through a respite training model incorporated into nursing. And then the program in New York, Abby, you'll probably know about this program. It's an undergraduate program, and it's across disciplines. And a woman named Sharon Leary at SUNY Geneseo directed this program, and it was for Alzheimer's patients. But it's an absolutely wonderful podcast, because she's like one of the most wonderful people I've ever met, and her program was recognized as innovative and exemplary. But she talked about how students from different disciplines went on to do graduate work with an emphasis on respite. The program was really life-changing for people in their career trajectory. So we don't have a lot of people doing this, but we have some people that are thinking about this, making it work, and might be good maybe for Oklahoma and Nevada to get together with Rhode Island and with Melissa Leeson. We could facilitate that, maybe just have a conversation together.
Yeah. I think
And-
my goal is, again, our leadership doesn't want our fingers on anything that we're referring somebody
Right.
to, but if we could get my goal kind of right now is just to get the curriculum or get on the radar of academia to present, and here's some curriculum for you. Tweak it, do
Yeah.
whatever, but at least it's a basis. They don't have to start from ground zero.
Yeah.
And to get that to them and to show them the importance of that. How many
Yeah.
people go through medical school and never get any gerontology to them,
Right.
primary care stuff, that's where I would like to figure out that missing piece. How can we interject there and then still make our leadership feel good that our fingers aren't saying, well, why don't you go try this respite provider, and then something happened and it comes back on us. But we can educate, and get
Yeah.
it. So I am all in. If you have, and Nevada or Susan, whoever, anybody, I would love to be connected to anybody
Yes.
with that.
Yeah, I was gonna say, Susan, is there a way for you to send the links to those podcasts out as well, so we can maybe listen to them?
Sure. And Jill sent them out in there in the last newsletter, but we'll resend them.
Oh, okay.
And they're, well, I worked on them. So like, I'm not bragging about myself, but I'm telling you, these interviews with, there are 3 different interviews. You'll just be so proud to be part of respite when you hear these. And I learned so much from doing them, but this, this is I think if you think back to deinstitutionalization and when special education started, the whole model for building this out of whole cloth. I mean, there was nothing in special education, was to set up these university centers that did research to document what they were doing, to do the service outreach part and do the training part. Those are the three parts. And so I think this training initiative out of Wisconsin, and those of you that are taking this on and trying to figure out how to do it, I think you're the trailblazers. And I think what you're doing is going to really build a strong respite system, and it'll be critical for sustainability, but also for accessibility and, you know, finding good people to provide good services. So it kind of just checks all the boxes. So I'm very excited that you're doing these initiatives and taking this on. It's really great. So I'll definitely connect you with people, and just thinking Rhode Island would be a really good place to start.
Another great place is Massachusetts, because they
Oh, yes.
they are using the Nashby Arch Respite Care Association training, piloting it in a university, but they're going to go statewide. So they would just be great people to talk to about how do you convince your administration that this is a worthwhile training to use. It's beyond just the program piece. And I'm thinking, Nadine, couldn't you, with some of your mini grants, you're not permitted to even start up new respite services?
Oh, no, that's not
Oh.
It's the respite registry, having a registry where we have individuals on there that we're recommending.
Right, no, yeah, I understand that, but I'm not sure how that links to the university-based respite programs. You could still fund, I mean, not beyond the training, you could actually train nursing students and other students to do respite within
Right.
their curriculum as part of
Right.
their training.
Yeah, that's the track I'm going, Jill. I just got to stay
Yeah,
away
no,
from
beyond just the training, though, actually getting the services
Yeah.
out there. So Massachusetts, because they're piloting it now, they're going to have great data, and they're going to go statewide once the data are available. So that would be, I'll send you the names of those folks too.
Thank you, Jill. Appreciate it.
Well, this is exciting. So
And for
Jill-
those of you who are not getting my emails, please let me know, because I did send out the podcast thing a couple of times and put it in the Arch newsletter.
I found it. I just,
Okay.
I put it in the chat in case anybody wants to listen to it,
Oh.
and copy it.
Thank you.
Thanks.
That way you don't have to send it out again, but
You can also listen to it on Spotify, Google Podcasts, iTunes. I'm so proud of having accomplished that.
Podcaster a little bit more informative. That I've not been a big podcaster, but yeah, I'm getting better at it.
I'm not a podcaster either. But it was really fun doing it. It's fun talking to those programs.
Something like this is actually what I was thinking about using in some of the rural areas. They have CNA programs. So like for the Helping Hands of Vegas Valley, our grants, we only allow the user, the caregiver, to use an agency. Well, we don't have any agencies, but I'm trying to get it where the CNAs out in like Lincoln County. It's a really rural area for the rest of us, but it's one of the counties my grant covers. I'm trying to get it where either they work through an agency down south, and the agency doesn't have to have a brick and mortar place there, but they hire some of the CNAs because they're already background checked and they already have the respite and stuff like that. Well, the rural counties are a little bit more depressed, so this just helps that person. And it would also expand the reach of respite. So that's one of the things I'm working with also, you know, that I came up with during Lifespan conference was an outside of the box way of thinking. I was like, oh, well, they don't have to have a brick and mortar, but maybe some of the CNA companies, you know, training places, the hospitals that have CNAs, they would be able to, you know, work within and provide respite through the agencies that way.
Yeah.
So that was something I'm working on a way to approach a couple of the agencies that I work really well with down in Vegas and go that way.
Yeah.
So.
And Nadine, I'm sorry, I was just gonna say, you might want to reach out to Doris, because a lot of her mini grantees, they are using students from like social work and nursing programs, and they're required to go through the RCAW training as part of the mini grant. And also the coalition is a recipient of an Exhale grant, and they are developing a drop-in respite program that's run by students. And they're also, as part of that grant, going to develop a toolkit that other colleges can use to replicate the drop-in program.
Doris has that, but both of those Doris has.
Yeah.
Awesome.
And I also just put I put the link to the actual podcast series in the
Okay.
link. I'm not sure what the link was that Corey put in there. Might be interesting, but it's not ours as far as I
Oh,
know.
well, I copied it from the thing, so I don't know. Okay, thank you. I apologize. But
No
the other
problem.
thing I was thinking of was daycares, adult daycares may be a place that the nurses could do their internship type thing for both us in Nevada and you guys in Oklahoma, just because that is a place of respite and they're supervised there. So that may be something that could be, I don't know, something that you would work on too. I don't know.
Yeah.
Just throwing out ideas when Yaz was talking about the need for supervision. I know we work with Toro University at Helping Hands for some of our what do you call it, assessments. And the nursing students come in and they meet with our case managers, and then they go out in pairs and they do assessments for our transportation and food pantry and respite program if need be. But and then they come back and they work on a group presentation. That's part of they do it for for a semester. So that's part of their intern program that they work with Helping Hands on. And they interview all of the departments, learn about our departments, and then they go forth and they do the assessments as needed. And it really helps our case managers do reassessments specifically, but they're already background checked and things like that too. So we have that covered in that regard.
Yeah. These are great ideas, and we're already over time, but I'm hoping that we can revisit this conversation. I would love to have, I don't know how this could happen. Arch can talk about it later, but I'd love to have somehow everybody at a table together that's doing something or wants to do something, and we could understand what the options are and how people went about cobbling things together to make these programs, because there seems to be a real diversity of approach and a lot of things that are going on. So maybe we can figure out a way to exchange information as we go. Definitely Nevada, Oklahoma, and New York need to be talking about this stuff together, because you're all sort of on the same page. This is great. Really, really great.
We will
Okay,
be in
and-
touch.
Yeah. Yeah. And if we can facilitate something like everybody getting together and having a conversation and, start to exchange information, we would love to do that.
Great. Thank you, Susan.
Yeah. Thank you. That was a good question. I'm glad you
That
asked.
was a great question. Yeah.
Well, it's something I'm struggling with. I'm trying, it's because funding kind of had to be, we had to kind of figure out back up and punt again. And so just trying to figure out now what's that look like. You come up with these plans and then somebody else says, no, we're not going to go there. And you have to kind of step back and think, okay, now what? And, starting up new programs takes time, especially in the biggest state agency in Oklahoma. It's not easy, but you just keep pushing and have a good plan in place and hope it rolls. So that's where
Yeah.
we're at.
And if you find the right person to start this, and what I've learned from talking to those programs that are doing this, the university programs, they are so valued and valuable, and the students value them so much that it's going to take hold. It's kind of just figuring out those first steps.
Yeah, I agree. Thank you.
Yeah. Okay, I'll let you all go with my best wishes for happy holidays, peaceful, wonderful times for all of you.
Thank you.
Thank
Okay.
you.
Happy holidays, Merry Christmas.
Happy
everybody.
holidays.
We'll,
Take care.
we'll see you in January.
Mhm.
Take care, everyone.